Hi, I'm Grant Garcia at Orthopedic Specialist of Seattle, and today I want to talk about a topic called shoulder arthritis or shoulder replacements. Just like the hip or knee, the shoulder wears out. The problem is that patients don't walk on it, so in general, my patients tend to wait longer than the hip or knee patients. And the other issue is patients tend to wait longer because they're concerned that they've heard from their friends or seen on the internet that shoulder replacements do quite poorly. This is incorrect. We've seen excellent data at around 90 to 95% good results at 10 years and around 85 to 90% good results at 15 years. Also, another complaint I get from patients before the surgery is they were told they would never be able to go back to doing sports. This is far from correct. I've lectured all over the world on this topic and have written a number of publications, and the rate of return to sports after shoulder replacements is upwards of 90%. And the most common comment I get after surgery is the patients wish that they had done the surgery sooner. Now, that's one part of it. The second part you should know is statistics on shoulder replacements are increasing exponentially. But that doesn't mean you should go to anybody. It's still a complex issue, and it is not the same as a knee or hip replacement. When you have a small socket such as that, and if the plastic piece is put in incorrectly, it can lead to catastrophic wear, and it's something that can be difficult to fix. And again, when you have a complicated issue, you need to have complicated implants and a person that understands these things. And at Orthopedic Specialist of Seattle, we do. I have patients that are complicated, that may be worn down their socket too much. I have special implants that I can build it back up and make it into a natural standard shoulder replacement. I also offer something called stemless shoulder replacement, and my website I'll give you at the end has more information on it. But basically what it is we spare bone, and patients that are younger, it offers a good option and excellent results. It decreases operative time and allows me to give patients that are younger this better advantage. Now, something else we do that's unique, and especially unique to the Seattle area, is we plan all of our surgeries to a customized approach. And what does that mean? Well, when a patient comes in my office and they're a candidate for shoulder replacement, I get a CAT scan on them. And I get this because I have special software that I plan each person's surgery individually each time. And I can actually run the simulation of the surgery, plan the implants, and understand how I'm going to make this patient's pain go away and motion improve. And when I go into the surgical operating room, I have decreased operative time because of this, and I almost always have the implants ahead of time that I need. The other reason to do this, and this is the part you may not be thinking about, is generally, even from a good x-ray or a CT scan, there are certain things that we can't always anticipate in the operating room. With this preoperative planning, I'm able to find out if someone has something more complicated they need to take care of. And if needed, I can build special guides or custom implants for people to allow them to have the best function and best range of motion. Now, if you've had a complicated issue, or you just have shoulder arthritis in general, or maybe you're not happy with your shoulder replacement you currently have, you should take a look at my website at www.grantgarciamd.com and make your consultation today. Thank you.